Today, let's talk about psychiatric drug development. But since I already talked a lot about uh, drugs and how it works on the serotonergic system and helps depression to be cured, uh, but I will briefly go through it again. So there are lots of there are many types of drugs uh, to help depression. But in Korea, escitalopram is the most commonly prescribed medication. This is SSRI, which means it blocks the reuptake of serotonin. It works on SERT, and how it works is basically how it works is uh, one of the three category based on the video link the professor shared. So this is inhibitors. It works as an inhibitors. So it's attached to it attaches to SERT where serotonin would normally would attach to, but it uh but it doesn't it kind of deactivate the SERT so that no serotonin could be reabsorbed to back to the cell. And that was zoom in, and the zoom out I talked about other parts. For example, in the zoom in parts we only talked about uh, reuptake, but we have other terminations of serotonin or neurotransmitters. They have degradation and diffusion. And since diffusion, as far as I know, is not something you can control with chemicals or drugs because it's very physical thing and chemical things, it's really hard to control diffusion. And there are also drugs on uh, degradation. So they block MAO from degrading serotonin inside a cell. But as I said, it dangerously interacts with foods and meds, so we don't normally use that. And there are other than medication, but since we're talking about medication, we're not going to talk about it. But what we're focusing on today is LSD. Uh, the parts that I wasn't able to answer perfectly on the last class. Uh, so the professor asked me why LSD is legal in many countries and why it's dangerous. Although I'm not able to um, perfectly understand why it's dangerous, but I kind of searched up, and LSD is so according to the video the professor shared, LSD is not strictly an agonist nor antagonist nor inhibitors. It's partial agonist. Uh, so before talk about this, let me briefly re-explain the concept of agonists, antagonists, and inhibitors. Inhibitors, as I explained, they blocks the uh, reuptake. And agonist is a chemical that acts uh, very similarly to the target neurotransmitter. For example, for serotonin, so any chemicals that would activate the receptor, just like serotonin, would be agonist. And antagonist, vice versa, it's a chemical that deactivates the receptor. Any chemicals that blocks the receptor to work. And LSD is partial agonist, so it does activate the receptor similar to serotonin, but not similar enough. In a strange way, it deforms. Uh, it kind of it kind of changes the intracellular activity. So when LSD binds to the receptor, the cell becomes uh doesn't work in a normal way. So they act differently. So before LSD attaches, the cell would do work we normally expect, like the action potential uh, uh, and resting membrane potential things. But when LSD attaches to it, it calculates chemicals in a different way, and the chemicals it absorbs, it lets in and lets out changes. So when LSD is attached to the cell, so basically cell changes the way it works. So it kind of make you, especially the LSD attached to the cell on the um the visual cortex region. So it can generate hallucination, and as I said, the cell changes the way it works. So we cannot anticipate how it's gonna change your brain. At least when LSD is attached, it can kind of make you very depressed or very excited. So it's not anticipable. So that's why LSD is dangerous. And I thought about how, so since escitalopram, so this was about LSD, and the other thing is about how to improve uh, any drug effects. And since, as I said, escitalopram is the most commonly prescribed drug for depression in Korea, it's already known that it has very little side effects and linear effects. So it's good, but it's good enough. But I remember that when doctor prescribed me the escitalopram, he said escitalopram works after a long period of eating it. Uh, so so you have to eat escitalopram for a certain period so that to have an effect. And that takes about 4 weeks or a month. And I thought that part could be something we could improve. And I wondered why it takes so long. And the reason it takes so long is escitalopram, although as soon as you eat it, it works on the SERT, so it inhibits the reuptake serotonin. But the brain, the so if you block the reuptake, naturally the concentration of serotonin in the synaptic clefts increases. But since it increases with external stimulus, the receptors needs time to adapt to the change in concentration of serotonin. So in the beginning, although the concentration of serotonin between the synaptic clefts increased, the receptor doesn't allow doesn't follow the increased serotonin reuptake. So initially, it doesn't let in the serotonin. It blocks the serotonin to attach to the receptor. So that's why it takes 4 weeks for your brain or your receptors and other cells to adapt to the increased serotonin between the synaptic cleft. So after the 4 week, the receptors will now be like, oh, okay, now you can come in. I can see that it's normal, and then they will allow more serotonin to be absorbed. And maybe I thought if we prescribe or prescribe escitalopram with another medication that would activate receptor, maybe we can make it faster for the escitalopram to work, or we can include some chemicals inside escitalopram that would activate the receptors so that increased serotonin level because of reuptake inhibitors would so yes so basically you activate the receptor so that escitalopram can work. Yeah. So that's what I thought about how to improve the drug effects. Thank you.